So welcome everybody to this event, which I'm very excited to introduce you all to. For those of you that came here specifically to see Dr. Zand van Tulleken as the chair, very sorry he got called away at the last minute, so he's unable to chair, so I'm chairing instead. I'm Professor Maria Kett, and I'm Professor of Humanitarianism and Social Inclusion in the UCL Institute of Epidemiology and Healthcare, and I'm really excited to bring this panel to you today. We've got a fantastic range of speakers. I'll tell you a little bit more about each of them and myself in due course, but just to say we have Tariq Riebl from the Norwegian Refugee Council. We have Israel Balogun, who's currently a PhD student at UCL, but you'll hear more about Israel. We have Mouna Khaity, who's also another researcher, independent researcher. You'll hear more about Mouna shortly. And Chris Porter, who is FCDO, but currently all people here, note, are speaking in a personal capacity and not representing the views of their organisations. But of course, we'll draw on their enormous wealth of experience. We're really excited. This is part of the seminar series Public Health Voices, which is very much an open event to all, and it really wants to engage with the important interdisciplinary topics in the public health field today, and really trying to show how interdisciplinary we are. And I think you'll hear from the range of speakers that we really have got really interesting interdisciplinary perspectives. We've got a really exciting panel of experts in humanitarian policy, research, programme implementation, and they're going to reflect on the present and the future of humanitarianism, the global humanitarian workforce, and the value of UCL's new, I'm very excited about, MSc in Humanitarian Policy and Practice, and I'll tell you more about that very shortly. We know, and sadly it's all too relevant, preventing and responding to humanitarian emergencies is and continues to be a global priority. We have no shortage of conflict, disasters, pandemics, climate change in the world today, and they really do demand new ways of understanding and new ways of working, and we'll hear about that shortly. Our panel will grapple with a range of questions about what humanitarian action looks like now and how it must change to remain fit for purpose in the future. We'll explore questions about what and who constitutes a humanitarian, a title that we could argue distorts the true diversity of the humanitarian workforce through imagery and storytelling. I'm really excited and welcome the panel here, and I'll ask them to introduce themselves shortly. Bit of sort of housekeeping. We're not expecting a fire drill, so if the alarm goes off, please follow the events staff, and hopefully you will notice the signs for the bathrooms. There are bathrooms to the right and downstairs. As I say, we are filming and taking pictures throughout this event. If you don't want to be in the film, please can you notify the events staff. Before I ask our panel to introduce themselves, I want to tell you a little bit about the MSc programme, and then hopefully you won't have to hear any more about it for the rest of the evening. And it's really good to be launching this. We've been planning it for some time now. I have a background in anthropology, and I've worked for many years really at across the fields of international development and humanitarian work. Some of my earliest work was with displaced populations in Azerbaijan and Bosnia, and then even back then it was very clear that some of the most excluded people were people with disabilities and older adults, and that really led me to have a strong focus throughout my career on the inclusion of persons with disabilities in humanitarian responses. I've undertaken work. I was the Sphere focal point in 2010 for disability. And interestingly, a lot of our work was very much in partnership with charity. We were funded for a long time by a disability charity called Leonard Cheshire. And throughout that time, it's really given me an interesting perspective of that interface between academia, practitioners, advocates, activists, and policymakers. And I think that's been a really interesting perspective, and hopefully we'll be able to discuss that as we go on. More recently, I've been working with the Global Disability Innovation Hub around access to assistive technologies in humanitarian settings. And I guess it's partly all of these experiences have led me and my colleagues to develop the MSc in Humanitarian Policy and Practice. I think it's clear from the outset that we don't believe there is one way to be a humanitarian. Rather, there are many humanitarianisms. And as Françoise Duroc from MSF recently wrote, the term humanitarianism can often serve, and I quote, to overlook the political responsibilities of the crises it seeks to describe. It oversimplifies complex situations and neglects the causal factors that led to the outbreak of a war, or, for instance, the advent of a particularly lethal epidemic. We're setting up this MSc precisely to teach students to be able to unpick these complex situations, to have the tools to understand, assess and evaluate these causal factors and make up their own minds about the type of humanitarian they want to be, to give them the tools to make the changes that are needed, because they are much needed, as the humanitarian system itself knows, with its focus from the Grand Bargain in 2016 on localisation, participation, funding reforms, and ultimately transformation of the system. The programme offers students, hopefully some of you, a balance between the academic and practical skills you'll need through 8 core modules, which will teach students these skills to debate, to discuss and design their own projects. It will teach you to use evidence effectively to support your position, the ethics and theoretical bases with which you'll do this, as well as different methodological approaches you might use throughout your future careers. We are able to draw on our own health-focused experiences from the core programme team, that's myself and my colleague James Smith, but our focus is beyond health to understand the wider context of the sector. We will work across the wider UCL university, drawing on academics and experts from a range of disciplines, with a range of different perspectives, including colleagues from the Institute of Risk and Disaster Reduction, the Global Disability Innovation Hub, and elsewhere across UCL. I think it's really exciting that we've got a specific focus on humanitarian innovation, and we might touch upon that in our discussions, led by my colleague Ben Oldbury. We're very excited about this because as yet there are still very few courses that specifically offer this focus, and there's a huge potential for innovation in the humanitarian sector. I'm sure Tariq will pick up some of these, right through to artificial intelligence, through to local product development, something Ben particularly works on. But we also know there are challenges associated with that, not least in who's included and who's left behind in those innovations. Again, I'll come back to my area of expertise around people with disabilities. Building on that specific expertise and interest, we've got a strong focus and, of course, a module on intersectionality, which will explore issues of power, equity and inclusion, as well as the challenges of delivering programmes within this framework. Often it's very difficult to take things from the academic perspective into the real world. Students will have an opportunity at an individual and a group level to work on projects with humanitarian actors and agencies. Students undertaking the programme will be able to draw on a wide range of resources, events such as these, and support that UCL has to offer. They'll have the opportunity to meet and potentially work with academics, practitioners and other stakeholders with a variety of skills and expertise, very much like those represented here on the panel today. And I'm really looking forward to hearing what you all have to say this evening. I'm now going to ask each of you to give a brief introduction and talk a little bit about your experiences and how you got to be where you are today. And I'm going to start with you, Tariq, because you're right next to me.
Great.
Over to you.
Thanks, Maria, and hi, everyone. Can you hear me? Yeah, great. Really great to be here. I actually started my career after a master's that wasn't on humanitarianism down the road at LSE 17 years ago. Went to Afghanistan and didn't really know what direction it would take, but very quickly found my way with emergencies with Médecins Sans Frontières, and then worked with Oxfam and the International Rescue Committee as an emergency country director. So I led a number of big responses around the world for many years, about 10 years total in the field, and then a couple of years doing evaluation, strategy reviews, and so forth. So really at the spear sort of the humanitarian side. Yeah, so usually shorter time periods in countries, but at very acute phases. The West Africa Ebola crisis, the Yemen civil war right on its outset, South Sudan after what happened there in 2013, and so forth, Typhoon Haiyan in the Philippines, and many others. So, so that's sort of my side where I'm coming from, because we'll have different ranges, and you'll already see that humanitarianism takes on many different sort of temporal settings as well within the work we do. Now I work with the Norwegian Refugee Council for 2 years at the head office level as one of the deputy program directors. And I'm in charge of basically all of what we call the development areas, which are areas emerging in the sector. So things like humanitarian access, durable solutions, climate environment, market systems, and all the digital programming we do. So quite a range of different types of work we do where innovation comes in. So it's in my job title as well, one of the innovation directors. Yeah, so now I, a bit more lazy than before, come up with fancy names for fancy concepts that other people need to implement in the field, but did spend many years on the ground as well. Thank you.
Thank you, Tariq. Israel.
Hello, everyone. My name is Israel Balogun. I'm a person with disability, and just to say, for now, I'm a Commonwealth scholar studying here at the University College London. Prior to this time, I'm in my second year rather. Prior to now, I'd worked in different contexts. First and foremost, what really led me to join the humanitarian mission came from a personal perspective. I was internally displaced in 2000. In the year 2000, when we had ethno-religious conflict in Jos Plateau State, I was displaced for 6 months as a person with disability. I graduated about 17 years ago, and I did my master's at the London School of Hygiene and Tropical Medicine in 2014, 2015 as a Shevlin scholar. And I went back home. Of course, prior to me coming, I remember I was in a hospital with my colleagues, and we were studying at the University of Jos University Teaching Hospital, which was very close to the main market in 2014. I was about going out, but one of my colleagues said, look, wait, Israel, don't go out. I said, why? He said, look, let's do our tutorial together. All of a sudden, we had a bomb blast that killed the largest number of people in a market setting in Nigeria, in Jos. And the incident taught me a lesson. And what happened was my colleague all ran away, okay? When they had the first bomb blast, everybody ran away. And I was telling them, please don't go, you know, because for the rule of engagement, I've learned as a person with disability, my survival strategy was for me to like keep low whenever there is any engagement before I even take off. They all ran out. They now came back again. The second bomb blast went and killed a lot of people. So going back home, I had to go back to the Northeast, where I was able to like work with CBM International. I brought about a change in the policy. The first audit that we had in the humanitarian setting for FCDO as a whole, the only audit for now, was the process I led while working with CBM International. And in the process, we realized that one of the most neglected people, not only across humanitarian, but across multiple facets of development, were persons with disabilities. They were not included in the humanitarian response. One of the largest funded projects in Nigeria was the NETAT project then. So I led the audit. I had to train humanitarian actors on the need for them to include persons with disabilities in their humanitarian responses. Subsequently, I moved to Ethiopia. I worked in Ethiopia at the height of the Tigray, before the Tigray crisis and during the Tigray crisis, where I also intervened across multiple projects, focusing on health, humanitarian work, education, the GEC project, and some other projects that really focus on livelihood in Ethiopia. Then I moved to Somalia. Okay, so my journey has been very, very transient. So I moved to Somalia. I stayed in Agesia, where I also worked in my humanitarian setting. And after that, I moved to Iraq. You know, it was in Iraq that my humanity was tested. I had to have interface with the Yazidis and the Muslim community. I brought them together in building a peaceful project, just to make them come together. But overall, my experiences have shaped me. I'm privileged, to have been able to get the little education I had, and I'm grateful to the British government, the Irish government, for giving me the opportunity. Actually, anger drove me to come back for my PhD. I'm angry with the system because whenever I see war, I think about the casualties. I think about those who will be injured. You know, I'm a doctor by training. My first thing is to save life. So that's one of the reasons why I decided to work in the field of assistive technology, looking at it from a humanitarian setting alone for persons with disability in northern Nigeria. Thank you so much.
Lots to come back on there, Israel. I'm sure people will be asking you about it.
Hello, everyone. My name is Mouna Khaity. I'm Syrian. I'm originally pharmacist and clinical biochemist. Actually, I was talking to Maria about how I get into this sector. It wasn't by choice. I was on the ground, an activist in Syria when the revolution started in Syria. And with my area was besieged. It started as partial besiege, and then it's become complete besiege in 2013. In 2013, Assad regime dropped chemical bomb on my home town. At that point, I'm gonna talk about anger a lot later, but anger need to be directed to certain position. It needs to become productive way to resist that kind of brutality and war crimes. So at that time, I was doing my master's in clinical biochemistry, which considered in Syria as laboratory medicine. I left the area for a few months, and at that time the area was become under complete siege. It wasn't easy to get in. Tried for several months to get into that area, and I knew that the last laboratory doctor in that area left with his family out of fear of his children lives. So at that time, returning to that area become moral obligation, and it's become also responsibility that I need to fill in, especially that this is my hometown, those my family, my own people. So after extremely risky journey, I returned to that area. I was freshly graduate with no experience whatsoever. I only have had at that time clinical experience. I didn't have any experience like regarding management or even like thinking out of the box. So when I returned there, of course, I was the only laboratory doctor for 400,000 people. Also, we faced shortage of medical staff. So, of course, I had to work on frontline on like field hospitals. It's not proper hospitals even at that time. And then we find an idea to create a paramedical education system to basically train young women and men to basically serve their own community to provide health care. And this was my main work in that area for years, from like teaching like abstract information to practical training, to training those students to work in Eastern Ghouta hospital and medical centers. So I always align myself with what's called humanitarian resistance concept, because my work is aligned with my political activism of working against that regime, against, and also war crime survival. I'm also working on that area regarding accountability for Syrian people and advocate for human rights. After I left Syria, because I forced to leave Syria on green buses, I was evacuated in 2018. I moved to the north of the country and then to Turkey. I worked with a feminist organization, so I'm also concerned of the intersectionality in humanitarian work. I work mainly on what it's called transformative justice regarding war crimes in Syria from feminist, of course, approach. And I came here on scholarship. It was funded by also the British government, and also it was funded also by St. George Medical School, so it was joint scholarship. So I did my master in global health and conflict, of course, and I'm working with as independent researcher, and also I'm working with a feminist Syrian organization. So yeah.
Thank you. Huge amounts of stuff there, Mouna, to unpack, so really interesting. I'm going to come and ask you a specific question in a minute. Chris, your turn.
Sorry, it's really humbling. I don't know how to follow that, really. It's really dull, my story. But I, after a first degree and lots of time having fun travelling, I wanted to try and put a sense of sort of a value around social justice. How could I get that into work, and saw humanitarian work as an area to get into, but got nowhere. Nobody wanted me. They didn't think I had the skills for some reason. So I then took an entry-level job that I could have done with 3 GCSEs in the British government, and worked quite hard. And fortunately, and we're not doing it at the moment, they then paid for my masters. And then also paid for me to go and work with UNHCR at a sort of field level for 2 years in Afghanistan, Liberia, and the headquarters. Then I left and joined OCHA in South Sudan at a sort of junior professional, a sort of a lower grade, but at a technical role. And then I had a sort of period where I've worked for small organisations as a consultant or sort of research, trying to accompany my wife, who also has a career in the sector. So maybe this is an issue that will come up later around juggling. It wasn't necessarily what I would like to have. It wouldn't be my perfect job, but it worked. And then since 2010, I've been working for the British government as a humanitarian advisor, mostly in East Africa. And now I've got the title of Humanitarian Head of Profession. So it's basically providing technical support to our colleagues around the world. We've got about 60 humanitarian advisors around the world who advise the ambassador or senior civil servants or ministers on, from a humanitarian perspective, providing sort of evidence-based advice on programme and policy. And I also do a bit of recruitment of our technical humanitarian advisors and engage with where we have really tricky problems, how we can support our teams and get evidence into our operations and policy.
So you're an excellent person to have as well on the panel. So thank you. You've given us a really, I think, 4 quite different routes, though there's obviously some overlaps and similarities, into the sort of sector, really. And I think that you embody a lot some of the things we want to talk about today. So I'm going back to you, Chris, with a really tricky question. Who constitutes a humanitarian?
So I was hoping you wouldn't ask me this one, and I was told 1 minute to go
Someone
that I
has
was
to.
going to get asked it. Well, I think hopefully what we've heard in the last few minutes sort of sums that up, that there isn't, maybe there's a media image of a humanitarian, which is somebody who's working for ICRC and probably looks a bit like me. But the truth is it's a much more diverse ecosystem, and actually most of the people who are taking most of the risks look quite different, and frontline workers in these countries taking daily risks. And so I think that's the sort of the opener. And an acknowledgement of that. I do think there's still a role for also the sort of international humanitarian community. I think it serves a complementary function and a useful function, but again, maybe we can have a chat about that later. Mm-hmm. And then I think there's a whole range of people who we might not label as humanitarian, because maybe that's something to do with values, and but who are helping us achieve or are essential to us achieving humanitarian objectives. So whether that's a diplomat or somebody working in the World Bank or a government, I think these are also people who are in our ecosystem and space, private sector. Sorry, I've forgotten. So I think that's so maybe I like to think of myself as a humanitarian. I didn't join government because I always dreamed of wearing a grey suit and being a civil servant, but I saw it as a way to maybe achieve some humanitarian objectives. So I think, just a single banner of humanitarian is quite difficult.
It's tempting to ask you if you achieve those objectives, but I don't know if that's fair. Tariq, what do you think humanitarian action looks like now, and how does it need to change to remain fit for purpose, given you've got innovation?
I really worked on the front line for many years, and I think what we're seeing more and more is less of that, which worries me. I think actually deploying in 72 hours or 48 hours and actually being there when things set off is exhilarating. I get goosebumps even now talking about it. I'm also an adrenaline junkie, which is its own set of issues. But you're really helping people in that moment of need. And I think that's why I want to do it. And I wanted to say there's something very precious about a universalist ethics. We talk a lot of ethic. We talk a lot about local service and so on. But I think it's actually very powerful to help someone you have no connection to. Nothing. You just go to a country, you read about it, and you work with people you have no connection to. And you feel the same empathy you would as if it's your, dearest friend or whatever. And I think that is actually real humanitarianism. So I think we shouldn't forget that in all the talk about, people helping each other sort of in their neighbors. It is much more powerful, that sense of humanity, and that's the primary principle, right? So I think we should never forget that. It's like, I feel the same way about an Afghan I helped and worked with, as I do about a South Sudanese or a Filipino. There's no difference for me. There's no hierarchy. There's no ranking. And there's no better or worse suffering. Oh, these people have it worse. No. If people need help, then we help. Having said that now, and going back to the frontline question, risk management, I hate the word risk, has seeped in everywhere. And Chris, probably of all of us, works the most with that, where it's about dealing with risks. And for me, this is a little bit like saying to a firefighter, you know what, you really shouldn't be running into that building because, I mean, you'd have to be crazy to do that. Yeah, but that's the whole point. Saying that this is a risky business is ridiculous. It's absurd, right? Of course it's risky. You have to be the firefighter that runs into that building. And we seem to be losing sight of that. And this is, again, where some of that localization debate hurts me. Because is it fair to ask a victim to help themselves? Is that okay? Is it okay to just throw a bucket into the burning building and say, hey, there's water there somewhere, just like extinguish it? No, I'm going to go in and help that person, right? So I think some of the quandaries we're facing in the sector is this risk aversion that's seeping in at all levels. Security risks, risks of kidnapping, risks of things going wrong, being accused of diverting to terrorist groups or proscribed groups, people that aren't savory, all these sorts of questions, and they're paralyzing us. So I think one of the key things we have to resolve is how do we still remain relevant? And I do think we have to be relevant. I mean, just turn on the news, right? It's all humanitarian that you see on there. But who is actually going in? And in some cases, we can't even go in anymore because we're totally forbidden from doing so. But in other cases, do we really go in anymore? So I think where innovation now comes in is that we have methods that can circumvent that. Digital is one of the big ones. So we're doing digital cash delivery. In Ukraine, we were able to do a huge amount of digital cash, even across front lines. In Gaza right now, we were able to send cash in within 48 hours. In Sudan, we're able to do that. So even where we don't have access directly, we're able to do things like that, where we can reach people directly. There's all these new technologies around AI, drones, all these sorts of exciting tools that we have that we didn't used to have, 3D printing and so forth. And then on the analog side, there's a lot as well. But I think there's a lot we can do to sort of reform the sector. Final point, though, I would say is we're very conservative, which seems bizarre, but we're very resistant to change. So once something works, we hold on to it for 20 years. So we need fresh ideas. So if any of you want to join, don't come and do what we did. You have to do something better. Be better. Do something new, something fresh. Don't let, old farts tell you that this is the way it's worked. And, in Darfur and in Bosnia and in, the South Sudan war, whatever, this work. No, we need to do better stuff, right? So.
I'm sure someone's going to ask a question about that in the open questions, but I'm going to ask you, Mouna, do you agree? Is that what humanitarian action looks like now, and is that how it needs to change, or does what Tariq say chime?
I'm going to talk from local point of view because I'm still holding to that mentality as local health worker and humanitarian worker. For me, there is lots of gaps that need to be addressed, lots of issues that need to be worked on. I'm going to start with the localization because I'm a big fan of localization. I think there is need to shift the power toward the local population to NGOs and key actors on the ground. And I can give example from the Syrian context. During the earthquake in southern Turkey and north Syria, Assad regime and Russia, they block access to humanitarian aid regarding the earthquake. So the only working group on the ground were Syrians, were the white helmets who provided rescue effort, who were able to reallocate resources. And basically it showed us that localization can be implemented and should be implemented, especially in those contexts with the conflict. It has been going on for the past 12 years. And also, in the current situation regarding also Tariq was talking about, that we stick to the same idea and we apply it in each situation or each context without basically studying the context that we are applying those projects. That there is a tendency to say there is one solution that fit into each context, and we can see that regarding projects regarding women women issue and protection. Some international NGOs in Syria, I'm giving lots of examples from Syria, they apply the same concept and understanding and the same project in Syria, where the community is completely different, religiously different, culturally different, and there is need also to consult local people regarding what kind of need they want, what their also point of view regarding application of all humanitarian concepts. And I think the current situation, and also from previous conflict, we see that also humanitarian aid is used as political instrument to pressure for certain political agendas. I've seen it a lot in Syria. I lived in besieged area. I was with my family, starved for years, without any access to medical services. Of course, proper medical services. So the humanitarian landscape is quite depressing right now. It needs lots of activism and lots of work to shift the current situation to better future for us, because we deserve, and people who are going through disastrous or conflict, they deserve to be provided with better solution to the current situation regarding humanitarian action. There is lots of mind.
I mean, it really builds on some of the things you talked about earlier, and I will come back to the other guys, but I just want to ask maybe Mouna and Israel, you talked about this sort of anger, and I guess the question is, how do you deal with those things that you can't control, and how do you manage to keep going in the face of this absolute overwhelming anger, and how do you Israel, how do you continue? You spoke about being angry.
Oh, thank you so much. For me, one of the things that precipitated the anger, beside the fact that I was involved in the crisis, was when a deaf student reached out to me in one of the special schools in the northeast of Nigeria, in Yobe, that I've gone there several years ago in a World Bank funded project to go and build their capacity on sexual and reproductive health. And the guy called me and he said, when Boko Haram came in the night, I'm a person with disability. Some of you might not have seen me. I have poliomyelitis. He said, when Boko Haram came in the night, they were shooting into the air, and everybody was running in different directions, and he couldn't hear. You follow the sound of the bullet or the weapon, to be able to know where to duck or where to run to. He said he didn't know where to run to. He said, but fortunately he survived, and that precipitated an anger within me. And I went directly, by privilege of being a Chevney alumnus, I wrote directly to the High Commissioner in Nigeria then, Balogun Khaity, and I said, sir, I look at the humanitarian response in the Northeast. You've not included a person with disability. When war starts, there's a proverb in my language that when war starts, 2 weeks before, person with disability ought to be running ahead of time, because I can't run. Like the example I gave earlier on, when the bomb blast happened in my hospital, my colleague ran and left me. And I told him, I said, look, it would be injustice for us not to intervene in this area. And they directed me to Simon Albert, who was the senior social policy advisor, and I met with him and I said, look, we need to change, we need to do something. He said, actually, you are correct, Israel. We've never thought about it. And here we are funding humanitarian actors with over 300 million pounds. And they've never considered persons with disability. In my interface with persons with disability in the region, I realized they said they've written to INGOs, local NGOs, and humanitarian actors, even UN agencies, they didn't respond to them at all. And occasionally, maybe by tiny drop, they give some of them, maybe they meet them along the road and they just like help them. But that wasn't the right approach. So that audit, it was in the process of carrying out that audit. I went there myself, even in the midst of when Boko Haram was bombing the town, I was conducting training. And I told the humanitarian, one of the things I always do is this, I carry person with disability from that environment. Though they don't speak, they don't understand the language, of course they don't speak English, I will ask them to like speak, let them hear their voice. I said, look, these people have written to you, you didn't do anything. Where is your conscience? Where is your humanity? I mean, we are supposed to be neutral. We are supposed to adhere to all the principles of humanitarianism, which he never did. So that alone pricked the conscience of most actors. As a result of that audit, the British government asked us to go and do a lot of training for humanitarian actors on how to mainstream disability inclusion into humanitarian side, which we did. I mean, currently that's one of the things I'm doing. The other anger that came to me was when I went to Iraq, and I had to bring the Yazidis and the Sunni Muslims together for us to build a peaceful future, trying to resolve crisis within them. And during the break time, one of them called me aside. The Yazidi lady said, look, do you know what these people did to us? We're neighbors. They came, they killed all our men, and you want me to talk to them? I was like, look, I've lost friends in my country. I came from Nigeria. I've lost neighbors. I've lost family members to crisis. But still, despite the fact that I'm a Christian, I still went to the Northeast. Northeast, if you know the Nigerian context, Northeast is predominantly Muslim. I said, but my humanity will not allow me to like stop. So going forward, we need to broaden our anger should not be directed at maybe perpetrators alone, but it's for us to bring about a change in policy. It's for us to take action to make sure that we change the narrative for the both for the victim and for the perpetrator themselves. So I brought them together, and I realized by the time I spoke to them and gave them my own personal experiences, it changed their perspective. So it was out of anger that I came to study here at University College London, because a lot of actors, in crisis, if you survive, maybe you are injured for life. I saw soldiers in Somalia, that they discharge them without paying them pension. I hope you understand what it means for you to like fight a war on behalf of your country and lose your limb, and then just because you are now a person with disability, that's the end for you. I was mad. I said, this is the first time I'm seeing this. And in my country, a lot of soldiers, because I work in the field of disability, I've done a lot of legislation and policy in my country. A lot of soldiers calling me that, look, they can't say some things out, against the authorities, because their regular pension, their allowances don't even come regularly. And of course, that pension alone is not even enough to take care of their health needs that they sustain while fighting a battle on behalf of our country. These are some of the anger that drove me to come and look at assistive technology humanitarian setting.
Some of the points Israel you said, so I think it's really important. You've talked about that anger and being in the, of that community, but you also talked about humanity, and that's something you talked about as well. Mouna, is that, I asked about how do you not get consumed? Is there something about being in of the community, or having that external, having somebody bear witness, be your, be an external person that comes in? How does that? Yeah. Do you think that's something that?
Firstly, I don't think anyone who's working in humanitarian sector is not angry, sad, depressed all the time. And I've never knew anyone who left that sector. People get stuck in that sector. They might change their career path from development to relief to research or academia, but they are stuck in that sector. But for me, I think also it's worth to mention that local humanitarian workers receive little support regarding mental health. Like after I've been displaced from Syria, I've been left alone without any kind of like support from the. I was working with one of the biggest Syrian organizations on the ground. So, but they don't have the adequate resources to support people. However, humanitarian international humanitarian organizations, they support their worker regarding mental health and all of that issue. For me, anger is also is related to a cause that I believe in, to a political call to the need of accountability regarding war crimes in Syria. So I don't have the luxury to be. Sometimes I get extremely depressed. It's a human nature, but I don't have the luxury to say I'm depressed and I'm gonna stay away from that issue. Like, of course, my mom, like all moms, she wants me to get married and stay at home. Or get PhD, not get close to any accountability efforts in Syria. But this is not choice, because I lost family members and close friends who basically got being killed or disappeared in Syria because of their ethical stance. So I feel this moral responsibility again. Sometimes it's tiring responsibility, but it's also my right to fight for myself. And also when I'm working on, especially because after I left Syria, I mainly worked on accountability project or justice project. So for me, I'm talking about my own rights, my own right to have sort of peace, internal peace regarding what I've witnessed in Syria. So mainly I'm directing that anger toward war criminals, basically, that keep pushing me to not give up. And I think also I have another element that keep me also going, that I'm woman, I'm Middle Eastern woman, that there is few of us in humanitarian sector, in academia. I think also our point of view, our perspective need to be present in those spaces. So I think just shifting the anger towards something productive. And also, I have therapists, so.
Well, some organisations do provide therapy. Thank you, and that's really powerful again. And Chris, this seems like a deceptively easy question, but now I'm thinking it's probably really difficult to answer. Which was the sort of different skill sets and disciplines that are needed, but given what we've heard, that's quite a tough one now, I think. Let's have a go.
It is, isn't it? I mean, I think that. My starting point, I guess, for most of this audience will be what's the value of the international humanitarian worker? What's the value added? What do we bring that isn't already available in Syria, Ukraine, or elsewhere? I think just sort of reflecting maybe more parochially what I look for when I'm recruiting, but maybe it has a broader relevance, maybe not. So let's see what people think. So certainly we look for deep thematic expertise. And so what do I mean by that? People who are really on top of the evidence, the mistakes that we've made in the past, what works, not necessarily coming up with a standard model that they then take from there and then they then apply to there. How do you make how do you develop a bespoke strategy in response to whatever context that you're in? So I think that's a really critical thing. And when we say sort of that level of technical expertise, that could be around a thematic area. We need people who know how to do nutrition, health. We need logisticians. We need protection and lawyers. We need people who understand inclusion. But we also, I think, still also need people who understand the broader system at a system level. How does this all glue together? What has worked in terms of the bigger picture? Why haven't we progressed inclusion better than some other areas? Cash, maybe we've done quite well since 2016, but other areas like participation, accountability, we haven't. Why is that? What can we learn from? So just people who, so I'm looking for people who have that expertise to learn from the past. I think the other thing hasn't come up so much yet, but we can't deal with these issues by responding. There's just too much now, and I think I take Tariq's point that we still need people to rush in. There is great capacity there already, but even with that, we just can't deal with it. Like, it's just too much. The sort of the needs keep going up, and the resources are static or going down, and that's a reality globally, not just UK. So we need to try and prevent the impacts or reduce the impacts on civilians. How do you do that? Well, you've got to engage politically. And so certainly what we've always done, but now we probably term it something different. We call it humanitarian diplomacy. So whether you're a frontline ICRC delegate, whether you're somebody who's working for their community on protection and engagement with armed actors, or whether you're working at a diplomatic level, regionally, globally, trying to mobilise people to put pressure on different actors for to reduce the impact of civilians, or better still, peace building. That's slightly beyond my area, but trying to at least reduce the impact on civilians. So for me, humanitarian diplomacy is a really big thing, and that doesn't mean just saying, that's outrageous, you can't do that. It's how do you put pressure on? What are the levers that you can try and use? So for me, that's a really big part of what we're looking for. And also this ecosystem has just got so much bigger. When I started, I'm kind of engaged with the Red Cross movement, the UN, and INGOs. That was kind of my world. And now it's such a more complex system. Of course, we've covered the sort of civil society component. There's also governments and subnational governments. You've got the private sector. I probably every day engage as much thinking about how do we leverage the IFIs and the World Bank as I do about thinking how do we engage with UNICEF or something like that. There's climate finance now. How do we leverage climate finance to work in really difficult places? Because the amount of climate finance that currently goes to the most climate vulnerable places, which are generally conflict affected, is really minimal. It's outrageous. So how do you engage with those sorts of things? And thematically, that's quite interesting. Most of the humanitarian need we're dealing with now globally, 80% is conflict driven, and most of it's protracted. It's years, it's decades. So I guess others have made the point already. Do we keep doing the same thing, or are we trying to have a longer term planning horizon in terms of what we're trying to achieve in terms of humanitarian? How far can we go on the sort of resilience piece without structural change in terms of the nature of the conflict? Can you still do some things, or can you push others to do things? So we've been trying, I think, over the last 10 years to better crowd in development actors into crisis spaces. I think there's been progress. I mean, I really do, but not enough. Nowhere near enough. So not necessarily seeing that as, for our humanitarian advisors, it's not necessarily trying to get the humanitarian system itself to deliver everything. It's about trying to leverage and pull in others to do the right thing. But I'm really glad that the last one, just to sort of reinforce Tariq's point, is there are opportunities and risks around around technology, digitalization, and innovation, and how do we make the most of that? That's sort of more of a technical bit. There's also these big ways of working, and what we sort of have a technical competency framework that is on the website if you ever want to look at it. It's a bit long, but we have technical competencies that we recruit against, but we also have core behaviours and skills that we're looking for. And I think different organisations call them different things, but that is around communicating and influencing, the ability to work with others. You've mentioned working interdisciplinary way. That's so important now. I probably work with economists and health advisors as much as I do as just the core humanitarian crew and gang. And then this ability to bring in fresh ideas, challenge and disrupt, that is definitely needed. I'm not sure the humanitarian system is as sluggish as everyone would suggest. I think there have been innovations over the years, but we need more, for sure. And the other stuff that's more, you've touched on it, Mouna, but I do think it helps to be passionate about it because it's a pretty dark world out there at times. And I think maybe passion and anger are different, similar emotions. Now I work for a government. A government is not a humanitarian actor. do I feel frustrated sometimes? Do I achieve always what I want? No. I'm a civil servant. I'll try and give the best objective advice I can. That's really frustrating sometimes. But I'm not living. Anyway, people have got much more, take much greater risks and much more frustration. But I think just that. If one's, I'm lucky enough to have a lived experience where I don't feel an anger that's all consuming. So my therapy bill is cheaper. But and I do think that's possible because I'd probably be ineffective in the nature of my job if that was all consuming. But it's there and you have to manage it.
No. Yeah, I think that's a really important point, and we might come back to that family issue at some point. Tariq, I know you want to come in, and I'd like you to also think about the practical dilemmas, building on a little bit on what Chris has just said about what these practical dilemmas are and how aren't we moving forward.
Yeah, I think, Chris touched on a lot of things here. To build on that, I think the first practical dilemma is that obviously you're going to see enormous suffering, and we can only respond to a fraction of it, right? Mouna mentioned this, Chris mentioned it in terms of resources, Mouna mentioned it just in terms of the view also from the bottom. So it is about both having that activist nature of I can help, but then also the humility to realize I'm helping a small fraction, and then the even bigger humility that I'm not resolving the core issues. I actually found the latter empowering, and I think that's something to reflect on. I actually struggle with people that are very self-assured about resolving problems. I know how to solve Israel and Palestine. I know how to do it. I'm very cautious about things like that. And I actually think humanitarianism is empowering because you start seeing the person and you're able to help a little bit. And sometimes we can step back and say, oh my God, it's just incremental or tiny, but actually it's not. It really is of help. And I think that becomes empowering in a way that you can start seeing these openings in crises. So that's something to think about. But you have to think about that at a personal level. Are you able to do that? Because again, the anger, the pain can be overpowering. I mean, I don't know how many times I've cried at night, right, by what I've seen. I've so far never cried in front of a person because that's really a no-no. But still, that's tough, right? And the anger I felt, and sometimes I have used that anger then publicly. Yemen is a good example where the arms embargo I launched at the time, I was on the ground as one of the few foreigners, and I said, we have to do something about stopping the weapons sales to the Saudi-led coalition. And I used that anger in that way. But very often it's about pulling that back and finding the openings. Some other things I would say, you have to love complexity. There's no linearity, right? There's no linear solutions. There's no A to B causality. So just scrap all of that. When they say fog of war, it's true. It is fog of war, right? It's the unknown unknowns, to quote Rumsfeld. That's what you're dealing with daily. So you don't like routine. You love complexity. You love making lots of quick decisions without knowing all the factors behind them, right? Think about that again. So here we often talk about trauma surgeon versus GP. The general practitioner is going to do no harm at all, as much as they can, right? They're going to be cautious. You're not cautious here. You are going to amputate that limb, and you're going to do it several times a day. Are you comfortable with that? Making snap judgments, and then often realizing quite quickly you were wrong. But you don't have time to dwell on that. You need to go on to the next one. Chris was talking about that this doesn't just stop in the emergency phase. You could be 40 years in Afghanistan, and we are still trying to figure out, right? We still have a fog of war. We still don't know the answers, right? So this is perpetuating, and that is something to deal with. So I would say, and then I'll get more on the dilemma side, but on another personal level, think of this as an athlete's career in terms of the field. An athlete, like, by 33, 34 is done, right, in most cases. Like Usain Bolt just can't run anymore, right? He's still the same person. The same is true here. You cannot do this for decades. I mean, you can. We have people, I'm talking about frontline work here, field work. You have to take that step back. You have to take care of yourself. and also not be the savior, right? None of us are saviors. And I think that is very difficult because you can see the impact of your work and start thinking like, oh, I'm this person. You're not. You're just one person out of many. I would say in terms of dilemmas, one of the big things is being apolitical. It's very difficult. We've spoken actually of these sides. Sometimes you do speak out, but ultimately that can close doors to people. And that's very tough. People confuse human rights and humanitarianism. They're not the same thing. If you want to do human rights, go to Amnesty. And that's really important that everyone thinks about that. There have been colleagues of mine who've said the wrong thing, and it's cost us access. And then how do you tell the people that you can't go to the camp anymore because you had a big mouth? Is that really worth it, just that you felt good about it? Or did it actually do something? I think in Yemen, it was the right thing to speak out on the arms. And we said maybe we get kicked out, but in that case, it was important. But don't be too smart sometimes. Sometimes doing the simple thing can be good. So that's a big dilemma you're going to face all the time. How far do you go, right? How much can you say, and how much is it important to help? How political do you want to get? Chris said the biggest one is the resources. How do you use limited resources and channel them to the right people and to the right crises, right? This is very complicated. How do you compare Sudan to Ukraine? It's difficult. It sounds easy at a macro level. It's difficult at a personal level, right? How do you do that? I think one of the big dilemmas, the protracted conflicts, the protracted settings, how do we do better there? We have spent billions in Congo, billions in Somalia. Are people better off? No. We averted harm, but are they really better off for all the money we spend, all the time we've invested? So, I mean, that's a failure on our part, right? How can we do better? And I think that's really challenging. Those are the dilemmas that are really at the core. How can we spend that money better? How can we make it more effective? Go further on dilemmas.
No, I'm going to ask, actually, you've teed it up nicely. I'm going to ask you now, starting with Chris, actually, and quickly, because then I'm going to open it up for the audience. So quick sort of fire response. What do you think the biggest opportunity or untapped resources that we have to improve the humanitarian sector, given what you've all just said?
I think the capacity, recognising, unlocking and supporting the capacity that there is within countries is probably I think an area where it's under, we haven't reached its potential, and the world is changing. Like, capacities are changing in country every day, and I think digitalisation as well is also just levelling the playing field. So I think that would be my, if you're going to push me on one.
Thank you. Mouna, on the spot.
I think relying on local humanitarian workers, especially in conflict where it has been going for ages, is a key, and it is opportunity. People gain knowledge and they know their environment, how to react to any challenges on the ground. I think this is from like a human resources point of view, it's opportunity in those situations.
Thank you. For me, I will look at it from two perspectives. First, the humanitarian actors as a whole, there's need for them to have a broader overview to contextualize the situation of every conflict. And then, in one of my engagements with UN agents, because I've worked with World Bank and UN, different levels, I mean, you know, they tend to stick to the status quo. There's need for us to like be innovative, be open-minded, and embrace change. And above all, there's need for them to also take cognizance of the needs of the people who are affected, so that they will have their voice, their choice. It seems to be respected in virtually every intervention that they do. You know, doing that will save a lot in the long run.
And finally, Tariq?
I think it's what everyone here said, which is bringing in non-humanitarians into the solution. Chris mentioned the World Bank, the IFIs, development actors. Mouna's mentioned local parts. We've spoken about people with disabilities. We've spoken about all sorts of people, governments. I think ultimately bringing them in more. We are the sign of a failure, a systemic failure. And I think we cannot be more than the Band-Aid, right? So sometimes we let ourselves go beyond that because it's comfortable for power brokers to have us sort of cover up the worst. But we need to shy away from that and bring in those others and responsibilize them and say, we can only go so far, and now we need other people to step in. So I think that's the biggest opportunity.
Cliffhanger there, I'm going to bring this over. Okay, so we've had quite a range of perspectives, actually. I feel there's a bit of tension about international versus local, so it's good. So the floor is yours. Please, questions. I will give the not yet turned on roving mics to my colleague. So any questions, please put your hand up. We have about half an hour for questions, 25 minutes now. Sorry. Yes, at the back. And maybe you wanted to say who you are and who your question's for, or if it's for the panel.
Hello. Hello. Thank you. Hello, thank you very much. I'm Saba Boufked. I'm actually working at the Humanitarian and Conflict Response Institute in Manchester. I think this debate is fascinating, and I'm so glad that you brought in people from local and international perspective, because in my opinion, like when your question is in 2003, I think one of the biggest and most interesting discussion you're having is the role of local communities within the response, because the evidence is quite clear that the lack of engagement in communities is one of the biggest reasons why they fail. So just want to work on, I think that was one of the key questions. So maybe a bit more controversial question is, the elephant in the room is power. Like, we have money, and you've been talking about how all of you, I mean, many of you are related to British government funding and political, of course, aspect of the humanitarian response is something. So how do you balance power imbalance in humanitarian responses? Like, how do international stakeholders, I've seen it in the Ebola response, humanitarian workers come, turn out every 2 weeks we have a new one. Local communities are absolutely dismissed. They are here, they live there. They saw like batches of British doctors coming every 2 weeks. They knew what was happening, they knew what would fail, but again, structurally there was an issue. How do you give more power to communities in international responses?
Okay. Ooh, is that for anyone in particular, or should we go down the line? Who wants to start with that one? Yep, should we take a couple more questions and do them all together? Yeah. Do the back.
Hi, everyone. It's good to be here with you. My name is Zainab. I finished my degree here in Global Health and Development. To be honest, when I read the title of the event, What is Humanitarianism? I was like, this speaks to my soul. In current times, as a humanitarian, I'm enduring my own existential crisis. And it gets you questioning. Now, we've spoken, the panel members have spoken about the challenges, the risks, the depression, the anger. But my question is the relevance with what's happening, and following up on your question of power imbalances, the huge scrutiny on the humanitarian field right now, blatant call-outs of humanitarian hypocrisy. You think you'll still be able to sell this field, the humanitarian model, 10 years down the line, 5 years down the line, as that it's still relevant, it matters. Even if you're not doing huge impact, you're doing this very small impact, do you think it's still relevant when you're speaking with colleagues, your daughter, your son? Does your work actually matter in light of the entire chaos that's there? Is it relevant? Or the model is doomed to fail for a new model to come in?
Good question. And let's have one more, and then I'll go to the panel. Rachel, down front.
Sorry, making you walk.
It's warm in here.
Hi, my name's Elisha. I'm an MSA student in population health. Specifically, my question was related to what Mouna, you had mentioned, and this idea that humanitarianism can perhaps be systematically engaged from external agents to sort of propagate these negative impacts on local communities. For example, if you see COVID-19, when we talk about vaccine nationalism, these ideas that humanitarianism is like an agent of external power mechanisms. So I'm curious from that vantage point, and this is sort of like bouncing off of the two questions, how can humanitarianism be appropriately navigated to be receptive on a community level, whether that means in the local sense, the international sense, when you're looking at pandemic preparedness, humanitarianism sort of conflicts as well? I'm just curious what your opinions might be on that end.
Thank you. Good question. Oh, so tough. Power, relevance, and how do you sort of connect it back to communities? I'm going to start with you, Chris. Sorry.
Look, cracking questions, which I don't have the answers, because I don't think there is one. I guess I just want one sort of you'll shoot me down, but just sort of one thing I would say is that we love to kick the humanitarian system. We love to blame it for the failures of the world. I think that's a bit unfair. There's some good stuff going on as well. Some people are having their lives saved, their kids are, treated for things. And so I think it is still, for me, and I think this is an evidence-based view, there's still some extraordinary things happening that we should think, thank goodness we've got some sort of system, and it's not perfect, and my goodness, it can do better. I think there's also massive failures, on the more development side and on the political side, and I think we've just got to be careful not to kick humanitarian for the failures of other things. So I think but that doesn't mean I'm complacent, right? I think I'm really driven to try and make humanitarian action better, more relevant, and for it to adapt. But I think just a bit of a sort of a line on that. On the power piece. Yeah, it's an interesting one that we've in 2016, the World Humanitarian Summit was our big moment. We said we were going to do better on this. Not sure we have done much really. And what I think we're trying to think, ourselves of what are the blockers, rather than just saying we're going to do it. What are the real blockers to doing better? I think the localization banner it covers a lot of ground, right? I mean, if you're working in a government in many countries, you say, well, this is my responsibility, and it is, and it's not all necessarily just about working with civil society. Let's take the money as a perspective. How can we do better on involving people in the big discussions around money? How can we incorporate local voices more in the international humanitarian system at a country level? There are efforts to do that. Who's in your humanitarian country team? Who's influencing you? Who are you speaking to? Are you getting out of your compound and speaking to people about what they want? And if you have got a least bad decision to make, probably not a good one, but a least bad decision, have you asked people about it? So I think there are efforts underway where the big challenge to donors is you've all said you're going to transfer more money directly to national organisations or civil society. Why haven't you done it? It's really hard for a donor who, disperses over £1 billion a year to fund loads and loads and loads and loads of organisations. The UK taxpayer would not be happy with us having thousands of staff doing that. So we do need to have a business model where we can disperse larger sums of money for larger objectives. But then a lot of the things that we've pushed for with our NGO partners around passing on the administrative costs, the same level of administrative costs in their budget. So the stuff that covers your back office stuff that we pay for international NGOs, in the past a lot of that didn't get transferred at the same level to national partners. National partners were used like contractors. So now we try to ensure that pass down is happening. If we have got an NGO consortium, does it really need to be just international partners, or can you have a national partner who's part of that consortium and deciding on direction? So I think that there are efforts that are happening, and I think as capacity has also grown, those are accelerating, but we're not there yet. And this is a really, really live discussion in our own organisation. How can we do better? So kind of watch this space, but we appreciate we're not there yet.
Mouna, same question to you. Power, the dynamics, the relevance of the humanitarian sector, and really how do you get this to the local level?
I think I'm triggered by the current situation as well. I feel that I'm reliving the same situation where people left alone, being subjected to war crimes. I say it. So mainly, but we need to, there is a criticism to the whole system, of course, but also providing humanitarian aid and relief is the main need for the affected population. And that's basically can be linked to the power question. There is like multi-layer of imbalance in power regarding global north and global south. Even like among local actors, there is certain actors who gain tremendous power over other actors. So I think we are quite lazy regarding this work of rethinking about the whole humanitarian landscape, decolonizing, especially in these days. The term is being around everywhere. And also to do the learning and unlearning process all over the time to reflect what we are gaining on personal level as humanitarian workers, our organization, and so on the bigger picture. This is need to be reflected on like personal journey and also from organizational point of view. What's the last question?
Local actors. How do you get down to the local actors? Right?
This is, so I'm going to give example from the Syrian situation. Talking about localization have been going in all spaces with all international actors and donors, and they always bringing that subject to any conversation. And personally, I'm being consulted, basically provide my feedback to the FCDO regarding program in Syria. Not just me, most of Syrians who came on scholarship funded by the FCDO. And we are always talking about the importance of engaging with local actor and shifting the whole humanitarian response regarding Syria from to the local partners. But it's quite frustrating. Basically, they didn't become convinced of that until the earthquake happened, and the local actors who are the only one who responded to the situation. Even I know humanitarian organization and also civil society in Syria provided a roadmap toward localization in specific details. And I even printed it. I took it with me to several meetings, and people are still not aware of it in the FCDO, even they have been engaged in that process. So I think there is lots of need to be done regarding that situation. I think, and also can be applicable to Gaza situation. Also, Gazans are quite frustrated because the whole humanitarian response regarding Palestinians not just in the occupied territories and also in neighboring countries, they didn't shift from providing long-lasting, sustainable development to be able to be relying on themselves rather than relying on humanitarian relief all the time. So it's quite depressing, to be fair, but this is the whole situation.
Yeah. Point I think about that shifting to the development is something Chris touched on. Israel.
Well, thank you so much. For me, I mean, looking at the landscape as a whole, like Chris has said and also Mouna has said, we need to look at, I mean, there's no one bullet, one size fits all for this. We need to contextualize it. And as a person who have engaged with maybe international actors, foreign governments in my country, one of the things I always lay emphasis on is the need for them to consult the local actors to have an understanding of the situation. And different context differs across different countries. I mean, when I worked in Iraq, I didn't just, I mean, it also applies to us humanitarian actors. Sometimes we sit down, I can sit in my office and write a fantastic proposal and get the funding. But it won't make sense when implementing because it's going to be a challenge. And I had that situation in Iraq. One of the things I always talk to funders, government across different levels, they need for them to think about building the capacity of the local actors and bringing them on board, even if they don't have the capacity. One of the excuses they give is that they don't have the capacity to manage funds, large funds. You can't give, I mean, very few NGOs in Nigeria, for instance, will you be able to give like 5 million that they will give proper accountability mechanism of their spending. You know, you need to like track them. You need to build their capacity first. Then the other thing also that I feel the power dynamics, irrespective of the power dynamics, it will always be there across different layers. Like Chris rightly said, I mean, while working in Iraq, for instance, there are layers of, I mean, depending on which region you are, the Kurdish don't have access to enough finance like people in Baghdad. In Nigeria, the northern part has more money. The government of the day, a lot of power dynamics do come into play. But the need for funders, humanitarian actors, and everybody to come together and look, it's about humanity. It's not about our personal preferences. It's about justice. It's about equity. It's about fairness. And when you play that card, I think it works. I mean, in all my dealings with foreign government, I always bring that up. I mean, it worked for me in the UN with World Bank. I remember writing some proposal, and the World Bank said, no, you have to be political. I said, no, it's not about being politically correct. This was what these people said, and I promised them that I'm going to capture their words. I mean, you might not engage me next time as a consultant, but this was what they said, and I promised them that I will include their words. And I'm quoting them verbatim. I can give you record, and they agreed with me. And for that, we need to bring that mechanism in place where the voices of the people will count across multiple sectors. So for me, that will require a holistic approach. Thank you.
Last but not least, Tariq.
Yeah, I think again, just what Chris said is really important. I think people are confusing humanitarian with political and development. Like, is Ukraine because humanitarians didn't do a good job, or Sudan? Sudan, it's two generals that just decided to start bombing each other. And they're both Sudanese, by the way. Let's just be clear on that, right? Now, the humanitarian response has not been good enough. But what is the cause of it all? So let's really keep things in perspective. I was just in Congo again. I've spent 2.5 years there over the last 15 years. As a country director interim, we have 240 staff in Congo. 220 are Congolese. Yes, we're a Norwegian NGO, right? But is everyone Norwegian? There wasn't a single Norwegian in our staff. There were only 3 from the global north. 17 of the internationals were from the global south. Actually, most were African. So, again, this caricature is not evidence-based either, right? Even in the UN, in the Red Cross and Red Crescent movement, you don't see just a bunch of white people when we say international staff, right? The head of the WHO is Ethiopian, and so forth and so on. So I think we have to be very balanced. Also, it's one thing to have a small cyclone, there are plenty of big ones in Bangladesh, or a recurring seasonal flood in Mozambique, and say we should have local capacity to respond to that. I completely agree with that. You don't want the cavalry coming in for that. But how many people can set up a camp, and how many of you have set up a camp in the middle of the desert of Eastern Chad or South Sudan for 50,000 people? And how many of you have done it? You've done it, perfect. How many of you have done it in 6 weeks? Right? In Doloado, in Maban, in Gozbeda. That is really hard. And you can give as much money as you want to a local person, they're not going to do it. There are plenty of water engineers working for Veolia or Davis and Shurtleff that can't do it. Because it's not just about drilling somewhere where it's easy, right? Setting up pipelines and the whole time providing water. People need to drink today. And you need to drill in the middle of the desert. So Ebola was mentioned. How many virologists and epidemiologists know how to do work on Ebola? A handful. Hans Rosling was with me in Liberia. He's just passed away, but he's one of the preeminent people in the whole sector. Essentially like a quasi-Nobel laureate. And it was difficult to solve Ebola. I think it's because we often look at the global south and we forget that Germany failed when the Syrians came, right? They couldn't deal with 1 million refugees. Any of you see Hurricane Katrina? The world's richest economy? Local capacity, how did that work? How was Fukushima? When you say DRR, which country is the best DRR country in the world? Japan. How did they do with Fukushima? Local capacity. We can go on. We can go on. The recent hurricanes in the Caribbean, how did that work out? In Houston. You can take all of the countries. China, does China do really well? How did they do with COVID? Where did it start? In Wuhan. They had a lab in that town that was dealing on coronaviruses. How did that local capacity? So I think people confuse small disasters with big disasters. Big disasters about knowing how to do that in 3 days at scale. When you have 13 million people affected, it's not about local knowledge. It's about technical expertise at a world-class level. That could be local, but very often it isn't. And that is where we have to be complementary. You don't need to do an 18-month anthropological study to solve Ebola in that moment, right? You need to know how to treat Ebola, and then now the community engagement part. That was actually the turning point in Ebola, right? Because once the expertise was there on treatment, what was missing was outreach. But here again, let's not forget, I was in Liberia until 21 days after the last case. When we spoke to communities afterwards, after I left, most of them were upset with the Ministry of Health that for 6 months had done nothing. The people that were there in Liberia that were refusing to see that people were dying, that it wasn't just another normal sort of seasonal outbreak of malaria, but that there was something else going on, right? So I just again want to caution you a little bit about causality and finally say community and local actors are different things. We have to work with the community always. We are accountable to the community. But local actors, we have to be cautious, right? Sometimes they're the perpetrators. Sometimes they're involved. Sometimes they're impartial. I can go talk to the M23 in Congo. I can go talk to Al-Qaeda. Am I going to send a national of that country? Are you going to send a Sunni to talk to Hezbollah? No, of course not. These are all things that sound very easy. Let's just localize everything, but you're putting people at risk. The worst thing that's going to happen to me is I'm going to get kicked out of a country or get threatened. I've been shot at, but whatever. But if you live in that country and someone says, you know what? We know where you live. That's very different. So these are all these elements to think about, and I think that are very complex. Power imbalances completely, but it is very complex.
Well, you've got the last word there. The time's coming. I'm sure there's so many questions people want to ask you about that, so many things. I just wanted to come back a little bit about some of the sort of power and relevance. You know, I too worked in Liberia during the Ebola outbreak, and yes, there were many things, but you know, local capacity now, and certainly during the time, was massively built up, and probably there are people and certainly doctors working in Liberia that know much more about Ebola than many people who work for any international organisations now. But certainly some of the local communities certainly, did respond and, effectively themselves manage some of the crisis, manage some of the, what do you call it, when you put someone in a isolation, yeah. And, so there was definitely, I think there's, I take your point, but I think there's probably some grey around that area too, and I get that you're kind of being provocative. I think, I think what we have seen, and I'm going to sum up now and invite everyone to join us for refreshments, is I think you've touched on, I think this idea about relevance is actually really important when we talk about this system and the localisation. In a way, your point is well made. There is a relevance, right? There is, unfortunately, still a need, and we don't see that going away anytime soon. I think how we do it, how we think about it, who we work with, it really does need to change, and it is changing. I think it's different today to how it was when I started. I knocking on door of OCHA saying, I work with people with disabilities, and being sort of like, no one would dare do that now. No one would dare not consult with local communities. The extent to which they bring them into cluster meetings or whatever is still debatable. How we deliver money, using sort of digital transfers, giving people, much better and greater autonomy and still with accountability. So I think those things are changing. I guess the key to it, and this is, I guess, the bit that I'd love, is, the point you made, Chris, we haven't always learned. So that's the key bit, right? How do we learn and make, and obviously another shameless plug for our course. But, how do we stop making these same mistakes? Make it so it's relevant to the context. Make it so people have, genuine, participation, inclusion, all these nice words we use. How do we do that? I ask everyone, but how do you know when someone's capacity is built? How do you know when someone is participating? These are words we bandy about, but actually having a really good evidence base about them is still, I think, a bit of a work in progress. I really like the idea about resistance. I think I started by saying there's many different humanitarians, and I think you've really, each of you have really shown us some of those very different perspectives. And I think, increasingly the actors in this field are growing, Chris, and we've touched upon the private sector only slightly here. We would have had a very different panel if we'd have had representatives of the private sector and some of the other actors that are increasingly in the humanitarian space, and again, have a very different opinion about this. I think, we've also touched upon some of the really important ideas about disruption, and I think, Mouna and Israel, you've given us some really nice ideas about how you can be disruptive, but you can also be humanitarian. I think there's lots more to talk about. I invite you to join us for refreshments after, and if you have more questions, perhaps you can grab the panel after. But really, I want to say a huge thank you. I think you've brought up some really important points, and thank you for taking the time, and thank you to the audience for joining us.